Hello, my name is Dr. Luz Claudio. I am going to talk to you today about increasing diversity in environmental health scientists in Latin America. I am the chief of the Division of International Health at the Icahn School of Medicine at Mount Sinai, and it is located in New York City. Here's my URL. So if you would like to know more about my research and my training programs, you can go to drluzclaudio.com. I am originally from Puerto Rico, and I immigrated to the U.S., to New York, to study neuroscience. And at that time, I was surprised to see how there were very few people who looked like me in the sciences, especially in neuroscience. So as some of you probably know, people of color in the sciences are very few, and especially women of color in the US and in other places. And this graph shows how few we are in science, especially also in environmental medicine. In the blue graph, and the blue bar here shows the proportion of women of color in science. As you see that as you go up the academic ladder, we become fewer and fewer. And so I noticed that that was the case in my area of expertise. And that gave me the idea and the impetus to want to try to do something about increasing the diversity of scientists, especially in my area of environmental medicine. So my goal was to combine my academic training as an environmental scientist and also a neuroscientist, and together with my personal experience as a woman of color from Puerto Rico, to combine those two experiences and those two strengths in order to address diversity in the sciences, especially in environmental medicine. And this is important to me and to science in general, and especially as we talk about global environmental health, because there is an issue of environmental injustice around the world. Recently, the Lancet issued a special journal that looked at the burden of environmental exposures on health and death around the world. And they showed that low to middle income countries, which most of Latin American countries belong to that group of countries, have the highest burden of disease caused by environmental exposures, especially air pollution. And second was water pollution. So this is very important, and especially in Latin America, how the exposure to environmental pollution affects health and death in people in Latin America and all around the world. So to address this issue, I wanted to create some international training programs that help to provide resources and training and expertise in Latin America to create a group of environmental scientists that could address these issues. And so in about 20 years ago, actually, I created these training programs for environmental health sciences in Latin America. This resulted in, we had many achievements in these programs. We had collaborations and training with 62 Latin American fellows from different countries in Latin America. Together, we published over 300 peer-reviewed publications. We provided courses and workshops throughout Latin America in areas related to environmental health. We created and co-created and helped to produce and sustain a residency program in occupational medicine in Mexico. And we co-sponsored several international conferences. From this experience, I learned that there are at least 6 keys to achieving a successful training programs in global environmental health. And with my experience in Latin America, although I think that this can be applied to other places in the world. So the first key that I learned from this experience for a successful training program for diversifying environmental expertise in the world, especially in Latin America, is to be able to identify young junior scientists with innovative ideas in Latin America and around the world. And so one of the things that I continue to do, and I started doing then, and just as recently as last week, where I was at the International Society of Environmental Epidemiology conference in Athens, I was able to always identify young, new junior scientists with innovative ideas from developing countries in Latin America who, with some support, with some training, with some funding or connections, some impetus, some support, can bring their ideas in environmental health to fruition. So this is a way that we can establish collaborations with new investigators in those countries. The second key to these successful training programs in global environmental health that I have found has been to support in-country research that is relevant to local needs. I have known from experience that some with well-intentioned researchers and colleagues from the US and other countries go to Latin America and to other developing countries and establish their research interests based on their own research, their own interest, and use those countries as communities in those countries as subjects for their research. And although many new investigations have resulted from those research collaborations, my goal has been to establish research projects that are relevant and of concern to communities and those in those countries. So one example of this was a collaboration I did with a young investigator in Rio de Janeiro. His name is Frederico Perez. And he was working with communities of small farmers, and the exposure that they were having to pesticides in their work. So with him, we observed that, for example, this this farmer preparing his pesticide chemicals was wearing his protective gear like a scarf around his neck. And then when he would go to spray the fields, when his young son would come to talk to him, the son was not protected from exposure. So we developed a way to reach those communities and show them about exposure to pesticides to the whole family by using fotonovelas, which are like comic books, but with photographs, where we created a story about how to protect your family from exposure to pesticides. So in this photograph, people from the community are acting out how to reduce their exposure from bringing the protective gear drenched in chemicals and pesticides to the home, and how not to do that, how to leave those equipments outside, and how to talk to in the family about exposure to pesticides. And this was successful in helping people understand pesticide exposure in the whole family. A third key to successful training programs in global environmental health that I have found has been to gain institutional buy-in by involving the whole institution where these young investigators come from in Latin America as part of the training programs. And one of the things we've done is to create these courses in Latin America. In this case was in Mexico, where people from different countries in Latin America can join us together in Mexico. In this case, it was in Cuernavaca, to have courses in environmental and occupational medicine. Since the pandemic, we have actually moved these courses online, and we have created a virtual school for Latin American health workers, researchers, and scientists, completely in Spanish. We have several courses there. This is the URL for the virtual school. So if you're interested, please go visit there. There's a lot of resources in Spanish where we can offer online courses in public health and in environmental health. So the fourth key feature of the course of the training programs in global environmental health that I have created has been to provide long-term mentoring. And I think this is also important because the fellows that I have collaborated with and trained with in these Latin American countries, I have continued working with them throughout many years. And this has allowed us to have a network of collaborators around the world, not just in Latin America, but in other countries as well. And so this has allowed us to have like a burst view of researchers from different countries working in similar or related topics in environmental health. And that way I have been able to put people together in collaborations and support those collaborations. And this is a good example of that. In this project with Dr. João Machado Torres from Rio de Janeiro, we supported his work to track persistent organic pollutants from the rivers in the Amazon to the fish, to breast milk in mothers that was passed along to the children of the communities along the rivers. So he developed this method to track the persistent organic pollutants in these Amazonian rivers. Meanwhile, I had another collaborator in Chile who had access to Antarctica and had a site there for environmental experiments. So I collaborated in supporting a collaboration between Dr. Machado Torres and the team in Chile and Antarctica to utilize the same process the same methods that he developed in the Amazon to follow and track the persistent organic pollutants, to also do the same thing in Antarctica and track the persistent organic pollutants in the ice, in the eggs, and in the bodies of local birds from Antarctica. This was a very successful collaboration. So again, another example of how we can bring truly global environmental collaboration to enhance our understanding of environmental health. Another example of collaboration that I was able to establish with collaborators and trainees that I had in Costa Rica, and fellows that from Thailand in another collaboration that we brought together to collaborate in pesticide research. And the final key to successful training programs in global environmental health is to mentor the mentors. So now that my fellows in Latin America, over 20 years of training, many of them are now directors of training, their own training programs, and directors of departments and part of the ministries of health in those countries. I have also been able to train them in mentoring and publications, and being able to get their research out into the world through publication in scientific literature, in the international scientific literature, through a book that I wrote, How to Write and Publish Scientific Papers, the step-by-step guide, and which is now available also in Spanish. And so those fellows that I trained in Latin America, I are now mentors to my students from New York. I have many students who are also of the same kind of background as I am, people of color who are aspiring scientists, and I'm able to send them around the world to do research, mentored research with people who were my trainees in the past. And so this brings my projects to full circle, and we have a very enriching collaboration with trainees and fellows working together to expand the diversity of who can be a scientist in this world. And so with the collaborations that I've had in 15 research institutions in 9 countries, in 9 different countries, we are now poised to address one of the most important, I think, issues in global environmental health, which is environmental justice, global environmental justice, and collaborating and bringing in communities that are especially and dramatically affected by environmental injustices around the world. And here in Brazil, in Ecuador, and in other areas where indigenous communities are especially affected by environmental injustices. This the next steps in our goals for environmental health around the world. I say to people who are reluctant to fund our work in Latin America from the US is that their north is our south. We are all connected especially with the devastating effects of climate change that are occurring as we speak. And there is no borders to environmental injustices and environmental health issues. As you probably have heard right now, just last week, in my country of Puerto Rico, we've had another devastating hurricane after 5 years after an even more devastating hurricane that passed through our island and is now going through to the mainland of the US. Climate change and environmental devastation have no borders. They are affecting everybody around the world. And so we need to address these issues. This is the effects of the hurricanes in Puerto Rico. And we need to be able to gather the experience and of communities and community organizations in countries that are especially affected by these environmental hazards and climate change, to be able to test drinking water after a hurricane and be able to filter it with using materials that are commonly available, and supporting communities that are doing this kind of work, and continuing to work even by using solar panels to power our computers in order to be able to work in after a hurricane when there's no electricity. So those are the kinds of things that I think that diversity in researchers from around the world can provide to the science of environmental health. So to summarize the 5 key ideas that I've had for successful training programs to increase diversity in global environmental health is, number 1, to identify those young, innovative scientists from anywhere around the world that have new ideas, new approaches to environmental health, to support them in their home countries. That's number 2, to support them with funding, expertise, training, so that they can conduct those research projects in their countries that are relevant to their communities. Number 3 is to gain institutional buy-in by providing training programs and involving those institutions that are conducting work in those countries. Number 4 was to provide long-term mentoring, to not just go into a country, do a project and leave and never continue that relationship. It's important to continue to involve those partners and continue over the long term. And finally, to mentor those mentors so they can have a reciprocal interaction between our trainees, between our other institutions and fellow researchers, and those who we have partnered in other countries. And so I leave you with this thought, and it is this, that we don't inherit the earth. We inherit the earth, or we have the earth as an unknown right now for our children and our children's children in the future. And I hope that for me, my inspiration is my daughter in this picture. And I'm sure that for you as well, always remember that we do this work so that we have a better future for our children. Thank you so much for being with me in this presentation. And I'll see you in a few days to answer your questions. Thank you very much.